Kia ora, my name's Emily and I am a PGY2 at CCDHB.
Kia ora, I'm Shay. I'm a second year house officer at Wellington Hospital.
Hi, I'm Ing, one of a PGY2 house surgeon, and I'm currently in pediatric surgery at CCDHB.
Hello, my name is Von Paolo. I'm a PGY1 doctor here at Wellington Hospital, currently doing general medicine.
Probably one of the main things that you need to think about when you're coming to a DHB is actually the things outside of work, because believe it or not, in your first year as a house surgeon, it's those things that matter most. So thinking about your support systems and thinking about the place to live in as a whole. So I found Wellington absolutely amazing in terms of the range of activities, sports and clubs that you can get involved in, as well as the cafe scene, of course. In addition to that, I had a really robust support network, and as I say, this is so important and can't be emphasised enough.
Coming to Wellington was just a given. I've got family here. I went to school just down the road at Wellington College. I also got into an expensive hobby at med school, got into mountain biking. So this place has got heaps of trails and tracks.
And I've got this kind of aspiration to work in the coolest little capital in the world.
If you're interested in the outdoors, there are also plenty of opportunities for you in Wellington. Lots of walks, beaches, mountains to climb and places to explore.
So I've been exposed to medical specialties, surgical specialties and community specialties.
The Wellington region offers both the big hospital experience and the little hospital experience. So coming into a tertiary centre, I see lots of cool surgeries, lots of very rare pathology, lots of subspecialised things.
Like many of you, I probably didn't know exactly what I wanted to do when I left medical school.
This year was an amazing experience. I'm not going to deny it started off pretty tough. It was a new environment, but getting into general medicine, it was a great run to start off with, and then going on to general surgery, I got more freedom in being able to do more ward work as a house officer was quite an experience as well.
I thought that the peer educational supervisors were really supportive and on the ball when it came to recognising what my requirements were for getting my general registration.
The first couple of runs as a PGY1 have been wonderful. I started the year with neurosurgery, which has been a wonderful experience, a great team with lots of subspecialised and cool surgeries.
In the Wellington region, you get to have the opportunity to work in 4 different hospitals, and that's across 3 different DHBs. And of the 4 different hospitals, we've got tertiary level care hospital, secondary level care hospital, and also a rural hospital.
Being an Auckland graduate in what has traditionally been Otago territory has been a breeze. I've made lots of friends. Everyone's been very, very kind, very friendly, and that has added to my experience here.
Formal teaching is really well protected and really well respected by all of the clinical teams that I've been on.
They've got a diverse range of teaching topics, and this continues as you go to Waiarapa or Kenepuru, anywhere across the region. There's a big emphasis on continual educational development. What topped it off for my year was being on orthopaedics in Waiarapa. There's no registrar out there, so I'm the only house officer covering the department. The bosses are great. I'm basically operating as a registrar, doing the ward rounds, doing the paperwork, going off to theatre and helping and assisting in theatre, and then coming back and doing the paperwork as well. So that was an amazing experience.
So my educational supervisor is Lupe Tamapiao, and she's been wonderful. She's given me lots of career advice, been very supportive throughout the whole process, and has basically made me feel welcome here in Wellington and has kind of guided a path as to where I would like to be in the foreseeable future.
The RMO unit has been very supportive and helpful in allowing us to go to conferences and courses, workshops, and also letting some of the house officers, like myself, sit our surgical exams early in advance. So it's a great unit.
It's the best place to be, it's the best of both worlds.
I feel really well prepared to make my next career steps, no matter what they are.
Going forward, I've definitely signed up for another year. That's how much I've loved this place.
I'm Susan Andrews and I'm the unit manager for the RMO unit at Capital & Coast DHB. And we've got some camera. We have with us the 2 recruitment advisors, DHB. We have a representative who was a PGY1 last year who's going to speak with us. And we have a pre-vocational educational supervisor. So Capital & Coast DHB recruits for the Wellington region. So that will mean that when you come to this region, you will have the opportunity to work across 4 hospitals. Wellington City Hospital in Newtown, Korero Hospital out at Korero, Hutt Hospital in the Hutt Valley, and Wairarapa Hospital in Masterton. And somewhere in the first 2 years in your career, you will spend some time in one of those 4 hospitals. So when we recruit, we ask for you to give us some indication as to which of those hospitals you'd like to work in first, but you will all end up working there somewhere along the line. So I'm going to introduce the people who I've got with me. We've got Glenn Jones, who's the recruitment advisor, Athena Nguyen, who's the recruitment advisor, Chris Anderson, who is the pre-vocational educational supervisor, and Myra, who is our representative doctor, who's going to talk about her experiences working in the region last year. So what I'd like to do at this stage is to get Glenn to talk a bit about what our recruitment process is and how we would like to work with you to come and join us in Wellington.
Okay, good afternoon. My name's Glenn. I'm responsible, along with Athena, for the recruitment across Wellington region. The situation is you can contact us through the information on the ACE website regarding expression of interest. We are different to some other DHBs in that we interview all candidates. So what we ask you to do is to send us an expression of interest, which we will respond to, giving you some brief guidelines about the information we would like back. Following that, we will forward this to one of the pre-vocational educational supervisors who will contact you by text first to confirm a suitable time for a telephone interview. So that's the initial process. From the other things that we'll be looking at, we're aiming to get people who want to stay in the region long term. So you can put some thought into your reasons for wanting to come to the Wellington region, and these are all taken into account in terms of your application.
Kia ora tātou. My name's Maira Haimuna. I'm currently a PGY2 working in ED, and I have had the pleasure of working at CCDHB for the last 2 years and being in the Wellington region for the last 5 years. So very much been involved with this hospital and this DHB. To kind of give you a run through of how the process is, I can remember that it is quite scary and quite daunting, even if you're moving away from home or closer to home. Overall, it is a smooth process, and you get to your first day and you do think, yay, I've made it, okay? So leading up to kind of your ACE applications, make sure you get those done early, make sure you talk to your supervisors. There's very good communication from the RMO unit here. Different to other RMO units is that we have quite a big staff on board, so there are multiple people that will be keeping track of you and kind of having clear comms. Like was said before, there's then a text to organise an interview. That's over the phone. There are formal questions in that interview, but the feel of the interview is very much informal. It's them getting to know you and you getting to know them. After that, once you receive your acceptance letter, there are a few paperwork things that need to be sorted, and these are all kind of outlined in the email. I'm sure if you have more questions on those kinds of paperwork, you can send those through later. In terms of orientation, so it's a week-long orientation process, and that covers fun things like social events to things like payslips. So you get a broad range of things through that week. I think the key things for me were the resuscitation courses. So you get a good idea of how to manage acute situations and when to call for help. And that's a really good learning opportunity before going on to the wards. In the last year, I've covered ortho-geries, neurosurgery, general surgery, and general medicine, and then I've just completed a run in Masterton, which is a rural hospital just outside of Wellington as well. And just looking at those runs, you can see that there's quite a wide mix, and that's something that's quite unique to our hospital in terms of being able to do a run like neurosurgery and a run like general medicine, and then your gen surgery and your ortho-geries as well. So you get the subspecialties here. There's even runs like cardiothoracics, ENT. So those are all things that you wouldn't get in smaller hospitals. So it's a great opportunity if you're wanting to kind of try those things out. And then the last run that I've just completed, which was Masterton. So as you probably already know, CCDHB, you have your Kinaperu, Korero Hospital, your Lower Hutt, your Wellington City, and then there's Masterton in the Waitarapa, which I think is a beautiful place and where I really enjoyed. And I'm happy to answer further questions about that as well. But just for you to kind of look and think about that is that, you know, in the space of a year, you can work in a tertiary centre like Wellington, where you have helicopters coming in and specialties coming from Palmerston, North, New Plymouth. And then you can be in the rural centre where you have people coming from their farms into you, and then you're kind of on the other end sending people into Wellington. So it's such a broad mix, and you build so many skills, and you learn so much about your DHB and about medicine, and kind of building connections in the wider area as well. I'm currently on ED, and I'm really enjoying it. It's week 2, so again, that's another thing that you can pick up as a PGY too. So I think that's all from me at the moment.
Chris, can you talk about what sort of opportunities you have with the people from a pre-vocational supervisor point of view, and can you talk a bit about the teaching opportunities that we offer every week?
Sure, Susan. So again, my name is Chris Anderson. I'm one of the pre-vocational educational supervisors at Wellington Hospital. And so, as we've discussed, you likely will rotate amongst various different hospitals during your time here. In Wellington, we have dedicated PGY1 and PGY2 teaching programs. So as a PGY1, you have 2 hours of teaching on Tuesday afternoons between noon and 2 p.m. We tailor that to try and be sort of germane to what kinds of things you're going to need to know at various points throughout the course of the year. So, for example, in Q1, a lot of it is sort of basics in terms of management of stuff on the wards. So there's a talk on electrolytes, there's a talk on death certificates, there's talk on discharge summaries. And then as you get further in the year, we actually bring in a few more sort of vocational type things. So towards the end of the year, we have people from various subspecialties come and talk to you about what it's like to be an ENT surgeon, for example, what it's like to be a pediatrician, what the process is in terms of starting to think about a career in those various aspects, in those various fields. So that's it's a unique teaching program. We're reasonably proud of it. We try and update it yearly to based on feedback from all of you. And then as a PGY2, there's an hour-long teaching program on Thursdays. That, again, tends to be a little bit more practical. So a lot of that is done in the sim suite. So it could be procedural-based stuff, etc. So that's the sort of nuts and bolts of the teaching program that we offer here. If you're out at Kinaperu Hospital, you also would take part in the Wellington Hospital teaching. Usually that's via Zoom, which is, tends to be valuable, I think, in terms of not having to drive in and drive back out, though there are some sessions, specifically radiology, but the expectation is that you do come into the hospital.
One of the things I just thought about is a little bit about Wellington Hospital and where it's situated. It's situated in Newtown. Now, Newtown is not the easiest place to find parking in. We have some hospital parking, but obviously we don't have enough for everyone. So parking can present some issues sometimes. Like all cities, Wellington is not the cheapest city to live in, so you do need to be mindful. But what we find is a lot of the house surgeons group together in flats and houses together. And so they've usually got all of that sorted before they get here. And many of the TIs who've been here for the last year have already got all their accommodation sorted. But it is something to have a think about with Wellington. When you go out to Masterton, we have hospital accommodation available. So if you're paying for your flat in Wellington, then whilst you're in Masterton, then the hospital will cover your cost of your accommodation out there, so that you don't have to pay twice. And that's really important because it's difficult to get short-term accommodation in Wellington and then leave it for 3 months and then come back to it. When you go out to the hut, it's the same as being in Wellington. Sort of halfway between, so they're on the edge of the Wellington motorway and some of the suburbs there, like Johnsonville, Churton Park, so they can go both to the hut or here. If you have a preference for wanting to work in the hut, tell us about it, because people who want to work in that hospital, we'll always give some preference to. Likewise, if you'd really like to spend time out in Masterton in Q3 or Q4, then we will certainly make sure that you get your wish. We don't put PGY1s into Masterton in Q1 and Q2. We think it's better for you to be in Wellington where you've got more support, and also you're not able to do nights in that first period. But once you get to Q3, you can have a fabulous experience out there, and the climate's getting a bit better as well. There's lots of things to do around Wellington, and Glenn can talk a bit about some of the activities that he knows many of the house officers are doing at the moment.
Okay. I was just going to go back a little bit before we get on to that regarding the successful candidates. What we offer for a successful candidate will get offered a selection of modules to choose from for their first PGY1 year. We've got 57 of these modules of 4, and they offer a mix of runs which will meet your PGY1 and medical council requirements and become the first steps towards your career focus. And there's a similar situation that goes on for PGY2, where we have about 70 modular runs on offer, so in those first 8 runs, we've got a vast variety of options for you, including community-based attachments. In terms of things to do around Wellington, well, I've been here 4 years now. It's a good little city by international standards. The obvious ones people talk about are the cafes, reasonable beaches, a lot of outdoor activities here, good for mountain bikers, hikers, all within easy range, and I suppose just the average entertainment options here, depending on what you like. Myra maybe can add a little bit more to that.
Yeah, I guess I can add a bit more. So I've been here 4 and a bit years. I'm very much an outdoor kind of person, and I think I can kind of do a lot here with that. So there's the beaches, I enjoy surfing, diving, there's walks and tramping. So you've got Tararua's, Mount Horsworth nearby, so in the Whanganui-a-Tara. So there's a lot of areas in the Wellington region to explore and get outdoors. I'm a bit of a foodie myself, and there are plenty of restaurants around here. One of them actually named in the top 100 restaurants in the world, so that's Hiakai if you're quite a foodie. And just kind of plenty of places, cocktail bars in general, all those things. And then like looking at Wellington as a city, you've got all the attractions of international, national sporting events and social functions, and those happen all year round. The last thing I'll add is the location of Wellington is very close to places like the Whanganui-a-Tara, Hawke's Bay isn't too far, even up to Taupo. There's a group of house officers who organise a snow trip every year. That's kind of more informal thing, that's not through the DHB or anything, but there is a keen group of boarders who organise for a weekend away to the snow. And then I guess the last thing is if you want to go anywhere else, there's a great airport.
Which is quick to get to.
Yes, yeah.
Very central.
Local.
I've just noticed there's a couple of questions that have come up. Somebody's asked, is Dr. Christine Mowat still involved in the application process? Yes, she is. She is also involved in us working with us to develop the modules, and we are about to have a meeting to look at what modules we're going to offer next year and other new ones we need to consider. So she will conduct some of the interviews with some of you. Some of the other pre-vocational supervisors will do the rest, but Dr. Mowat is the main person who helps us put together the applicants and order them and then allocate throughout the year. So we work very closely with Dr. Mowat. Another question is, when expressing your interest to work at CCDHB, does this have to happen before ACE applications close? The answer is no. If you are interested in working with us, complete the expression of interest, and then we can organise a telephone interview. At the same time, keep making your effort to get all your referees together and complete your process online. The interview date will happen as soon as we can start getting enough people organised. So some of them will possibly start before the application process closes. When we're starting to gather all the information from ACE, we also feed in the interview information as well.
Susan, can I just ask you one thing? Can you just clearly explain the difference between expressing your interest to work as opposed to the applicants preferencing and applying to the Wellington Regional DHBs by ACE?
The expression of interest is to get the interview. Because we do interview people, you need to tell us that you want to be interviewed. And that is a separate process from filling in and getting all your formal application through the ACE website.
So explicitly, also just for my own knowledge, how do the TIs do that? Is that by direct email to you, or is there a form that they need to fill out, etc.?
Comes through direct email to our RMO recruitment mailbox, and we will send the information back requesting ask them for their contact telephone number and just a brief statement about why they wish to work in Wellington, which gives an introduction for the peers when they make their interview call.
For those students who don't write an expression of interest email to you to request an interview on site, how will it affect those students who do not do that in terms of their application to your region?
Yeah, I mean, I would say that we typically would tend to rank people who've expressed an interest in the region higher. That doesn't mean that a spectacular candidate who has not put in an expression of interest won't be ranked highly.
So I guess the takeaway message from that is that for students who reference the Wellington Regional DHBs as part of their ACE application, you know, it goes without saying that you'll have to do a second process, which is contact the RMO recruitment team at CCDHB for an expression of interest letter or email, and go through that process as well.
I think if we look at what happened last year, all the candidates we took had all had a telephone interview of about 10 minutes with either Dr. Mowat or one of the other pre-vocational education supervisors. We take the ACE rankings into consideration. So if you rank very highly on ACE and you've got all your information together in your application, then you won't be disadvantaged.
Where can they find an expression of interest form? I think you've covered that. You need to email the recruitment team.
The RMO box at Capital and Coast will send you the form. And
so just to reiterate for the students, that particular email address is also listed on the employee information page on the ACE website. And if you can address that to Glenn, that'll ensure that he'll give you the feedback to go through that process. Am I right in saying that?
Yep, if it comes to the RMO recruitment inbox, either Glenn or Athena will respond, but it will be responded to. A question about rostering. Would you speak to rostering? We have rosters that are compliant with both Stones and the RDA MECAs. You will do some nights. There will be some services where you will do a 45-hour week. There are some where you'll be doing a few more hours. It just depends on the service that you're in. But the rostering coordinators do write the rosters to be compliant with the MECAs. They also do try to enable people to have annual leave when they can, bearing in mind that annual leave preferences in the first quarter can always be a little bit difficult when you've got other existing staff wanting leave, but we do try to meet those things. We have a question, do we have any advice for Australian graduates? New Zealand graduates take precedence. We are obliged under the ACE program to consider New Zealand graduates, so an Australian graduate in reality is unlikely to get a job for quarter one with us. That's not to say as vacancies happen later in the year that opportunities don't open up, but our obligation is to take New Zealand graduates. We expect to have 57 places next year for PGY1 graduates across the Wellington region. If you are in Wellington, because you're based here, you're very welcome to pop by and we can physically give you the form, but we're not always in the area where the RMO unit sits. We could be in meetings elsewhere. Process around leave applications. There is a standard leave form. The leave form goes to the RMO coordinator who undertakes the rostering for the service. We do try to get back to people as soon as possible. We have an obligation to do so within 14 days. Sometimes we may need to decline your leave initially and have to reconsider it a bit later once it's a bit clearer as to what resource we have on the floor. When do you start nights as a PGY1? Yeah, quarter two.
So I can talk to that. You can start nights if you've done a medical run, and most people do that like after first quarter, or it might be after second quarter if you've done other things in the community. Sometimes there might be a delay if you've been in the community.
On the information sheet, obstetrics and gynecology can be done as a PGY1 run after 6 months. Does the salary band vary for the different hospitals across the region? We have a Wellington regional band, so it depends on the service you're in. So for example, if you end up in a community-based attachment, then you will have a very different salary band from somebody who's on a general surgical ward. So it depends on what you're doing, not the actual hospital. Another question, is there any information regarding the rostering between the different hospitals, e.g. hours, long days, weekends?
So there's not specific information unless you ask for the contracts from each of those hospitals and then the job that you're doing at each of those hospitals. But I can broadly say that between Wellington and Hutt, it's very similar. So you're working your day job, so that's normally 7:30 or 8 o'clock till 4:30, and then you normally do one long day a week. So that would be from the morning 8 o'clock till about 10:30. So you're doing that evening shift, and that evening shift is the on-call shift. So that's generally once a week, and then normally once a month or every 3 weeks maybe you have a weekend. Across the surgical department, you do 1 day on, so you only work the Saturday or the Sunday, but across the medical department you do both days. And then if you're RDO, you'll get those RDOs as accordingly, 1 day or 2 days. And then in Hutt, you do one short day, so you do it across both days, but you do one short day and one long day. So one day will be, let's say, 8 till 4, and then the other day will be 8 till 10:30. And then in Masterton, because there is a smaller pool of doctors, you work more on calls. So you're doing every second weekend, and that might be including nights as well. So you do more on calls while you're on Masterton, and that is just the way it is. And then in Kinniperu, it's similar to kind of Wellington, but because it's a smaller hospital, the acuity of things aren't as high. So that's a general idea.
Just wondering if you can speak about any training, teaching and other learning opportunities at CCDHB if it hasn't been covered already?
Yeah, sure. So Dr. Anderson, Chris Anderson already talked about our predicted teaching time. So that's 2 hours once a week, and that's for all our PGY1s, and then PGY2s is 1 hour once a week. So that's kind of the formal teaching that's protected. There are so many other teaching opportunities just on the ward with the amount of kind of registrars and consultants that are around. Like all the other hospitals, you have those opportunities to do kind of courses and papers outside of your DHB, so the Otago papers, your RAPS courses, all those kinds of things. You can do that by applying to the DHB, and I was able to do that as a PGY1 with the support of Dr. Anderson actually. So you're more than welcome to kind of apply to those things outside of the DHB, and the DHB supports you financially and with leave. Other opportunities, I guess, well, just with ED, if you want to do ED, there's more kind of role plays and interactive ED situations in some suites as well. So that's something that I've come across.
Another question, just following up on the general working hours we mentioned. You're rostered until 4:30, but how often do you actually finish on time? I imagine it's run dependent.
Very much is run dependent and day dependent. You could be on surgery, neurosurgery in fact, and be, all set to go home by 2 o'clock, and then you could be on the medical ward and having to stay till 6. So it's run dependent, day dependent. It's very hard to say. I will definitely confirm that you will not go home at 4 o'clock every day. That's kind of as much as I can. Some days you might go home earlier, some days you might go home later. And I think that's not just a Wellington thing. Well, actually, I know that. I've spoken to colleagues at all hospitals, and that's a doctor thing.
It's also experience dependent, so you probably find yourself staying later as a Q1 PGY1, just as you learn sort of systems and basics, and then as you get more comfortable with that, people tend to become more efficient and get home early.
What are the main components that are going to make a really strong application for our TIs this year?
Probably their affinity and why they want to be in Wellington. If you are a bit indifferent about why you want to be in Wellington, we will place you lower down. But if you have some real ties to Wellington, maybe you've got family here, you may have sports commitments, it may be that you did your TI years here, that certainly is a major strength.
Strong references are also pretty important, just based on ranking day. So yeah, people who clearly are well regarded by the referees, I think tend to be ranked higher. Yeah. One thing that I will throw out there, just as something we do ask in the interview, and that you may have already gleaned is important, is that being able to drive, given that we have 4 hospitals spread across a wide region. So, if you can't drive, I think you may struggle trying to get to work on time if you're working in different hospitals. So it is something that we do ask about, and probably worth mentioning now.
We also do not have any bias towards which medical school you went to. We don't rate the medical school at all. We get a number of Auckland grads here, and we get a number of Otago grads here, and we're pleased to see you all. Are face-to-face interviews, introductions encouraged additional to the expression of interest? If yes, does this benefit your application? We don't do face-to-face interviews. If you want to pop in and see the RMO unit, that's fine, but it has no bearing on how we rank you. It won't add any additional information to your expression of interest or benefit your application. The oral interview by phone is more important. How many positions are there for PGY1 next year? We understand we have 57 coming to this region. What research opportunities are there while attached to Wellington hospitals?
So this is MIDA, the PGY2. So there are a few. We have the Otago University attached to us, so that can be a source of kind of tapping into research opportunities. So I've worked with the Irupumari, which is the Māori Health Centre over there, to do some kind of assisting and research there. And I've also worked with the surgical department there. They do kind of international research where you can kind of slot in and help with. Every year there is someone, kind of, if this is more for surgical, there's someone in the surgical department that kind of coordinates international studies. And so if you're interested in research, when you start a surgical run, you can indicate that to your registrars or your consultants, and they'll put you in touch with that person. It changes on a run a year-to-year kind of basis. And that is an opportunity for you to help with, it's mostly auditing, so going through patient records and putting numbers in databases. And so you can assist with that. And I've recently helped with a study looking at surgery with COVID patients, and that is to be published in the Lancet. So like just there, that's a fantastic minimum amount of work for great outcomes. There's also a chance to do an audit or kind of a health quality project in your PGY2. So during your PGY2, you are required to do a relief run, and that's mostly just because, you know, there's always relievers needed, and having a PGY2 to do that is normally the people that do it. And with that relief run, if you apply to do an audit or a quality health project, you get 1 day a week in that whole run protected for that project. And this can be a project that you decide on yourself. A colleague of mine has done one looking at consent in women of childbearing age, and I'm looking at doing one in third quarter, focusing on kind of Māori health inequities. So there are plenty of opportunities for research. I think that comes from being such a big centre attached to the university, and quite notable consultants with high kind of research background and contacts. So if you're interested in research, it's definitely one of the benefits of this hospital.
Are we asked clinical questions during the phone interview?
No. So actually, there's one question where we present a clinical situation. What I will say is that it's less about your knowledge base and more about how you would approach it, to be honest with you. So we're not going to be asking, you know, test-like questions like how many grams of paracetamol do you need to prescribe in this situation.
What pastoral care is available for house officers?
You have a variety of different resources. As pre-vocational educational supervisors, we're kind of your go-to if you're having issues, specifically run-related, or even, you know, if you're struggling in other ways. We're the ones who want to know about that fairly early on, and then we can then guide you or direct you to appropriate help if needed. There are other sort of informal pastoral care avenues as well, in terms of peers, colleagues, clinical supervisors, etc.
Is there a deadline for the expression of interest forms to be handed in?
We will need them prior to applications closing. So the sooner the better we can distribute them to the peers to contact you.
So just to be clear on that, the expression of interest request to you has to be done before ACE applications close on the 9th of July?
Yes.
Okay.
So the interview won't happen until after that, just to make that clear.
Sure. Yeah, that makes sense.
I think the best thing we can say about Wellington region is with the range of hospitals we have, you will get some fantastic opportunities and experiences. If you want to work in a hospital that's slightly smaller than Wellington, then Hutt Hospital is a great place to be. If you really want to experience a rural hospital and have the opportunities and to get more experience than you would get in a hospital like Wellington, Masterton is a great place to be. Each hospital provides tremendous learning opportunities, but they're all different. And you will find your niche. Some people spend the majority of their first year actually out at Hutt Hospital, and that's by choice. They get all the runs that they want to there. For others, they might spend all their time in Wellington, but we can offer something for everyone. And I think that's the most important thing, with the range of hospitals that you have access to and the range of clinicians.
Tēnā pai, thank you, whānau, to our SMO and RMO and DHB representatives for making themselves available. But I want to thank you all for attending, all of our panellists especially, giving us some really good insight into what it's like to work in the Wellington region amongst the 3 DHBs there, and wish you all the best.
Thank you very much. We look forward to seeing you all working here.